So in this particular picture, right here, first of all, I would like to draw your attention to this corticospinal. When we say corticospinal, as we mentioned earlier, it's going to give us an idea about where is it coming from, like the origin and destination, right? Corticospinal pathways, those are the motor pathways that are coming from the cortex. So this is first part here, cortex, and going to the spinal cord, to the anterior horn of the spinal cord. That's why it's named corticospinal pathways. So corticospinal pathways itself, we're going to discuss two types of them here. Coming from the primary motor cortex, going all the way until the anterior or ventral horn here of the spinal cord. This in red color, we're gonna call it the upper motor neuron. From here on, when we talk about upper motor neuron, we mean this part from this nucleus, right, the neuron here, and then the axons, the white matter, the axons of this neuron, when they descend down all the way until they reach the ventral horn or anterior horn, where they're going to synapse. The first order neuron is going to finish here, and then the second order neuron is going to start from right here, from the ventral horn or the anterior horn. The second order neuron is going to start from here after this synapse, and then this nucleus is going to give its axons, which will go at the second order neuron all the way to the skeletal muscles. Whether those skeletal muscles are in the extremities or they are in the axial skeleton, the back and the trunk. Okay, so let's recap this. I have upper motor neuron start from here, from the nuclei in the primary cortex, going all the way until the ventral anterior horn, where it's going to synapse with the second order neuron, which is going to start here in black color. The nuclei will give the axons, which will go and synapse with the skeletal muscles. Okay, now what is this? What is the other one? The other one is the cranial nerves. If you remember here, these are the spinal nerves, right? Coming from the motor homunculus, spinal nerves, giving you all what you need to move the muscles in the upper limb and in the lower limb, right? So the cranial nerves, they will give you the motor that you need to contract and move your facial muscles, and other muscles are related to the cranial nerves. So coming back here, this one is going to be related to the cranial nerves. It will come again from our primary cortex or motor cortex, right? And then the upper motor neuron will go all the way until the brainstem, until it reaches the brainstem. When it reaches the brainstem, you are going to have a motor nuclei there, where your first order neuron are going to finish, and they are going to synapse with the second order neuron. The second order neuron in the black color will go all the way until they reach the affected muscle, like, for example, the muscles of the face. And an example of that, of this what we call corticobulbar. This one, coming through the cranial nerve, we call it corticobulbar. A good example of that is the facial nerve, which enables you of moving your muscles of facial expression. So this is an example. This long one here is an example of the skeletal muscles and axial muscles of the trunk, right? And the other one here, the other type, the second type here, is an example of how the cranial nerves are gonna move your muscles of the face, for example, in case of facial nerve. So now we know upper motor neuron and lower motor neuron, and that has a clinical significance. I will just bring it up here, right? Knowing upper upper motor neuron, where does it start, where does it end, and knowing the second motor neuron, where does it start, where does it end, it has a clinical significance, particularly for those of you who are going to go in a profession schools, right, like med and the dentistry, and even the physical therapy and this and that, and kinesiology. So what will happen if you have a patient? If you have a patient coming to you, somebody who's having a stroke, right? Like if he's having a stroke on the right side hemisphere, then what will be affected the left side, right? You will see the patient. You will know, is he having a problem in upper motor neuron part or lower motor neuron part? If the lesion is in this red part here, in this part represented in red color, there's going to be upper motor neuron, right? And the patient will be having this, what we call a spastic paralysis. He will not be able to move his hand, for example, and his leg, right, and his lower extremity. But if you try to move it, you will see it's very rigid. That's called spastic paralysis, and that's telling you the lesion or the problem in this red part, right? While if the lesion or the problem in this black part, this black colored part here, what's the lower motor neuron, if the lesion is here, if the problem is here, then the patient is going to have what we call flaccid paralysis. That means he cannot move his hand and his leg, for example, but still if you move it, you can move it. It's very floppy. You can move it and throw it here and there, right? So it's flaccid, it's floppy, right? So this is a clinical significance I would like to draw your attention, so maybe the information is gonna stick to your mind in that way. Okay, so let's move our attention from this picture to that picture and see how the things work. So as we mentioned, the motor, this is a primary motor cortex or the motor cortex, right? And from here I have these neurons. I have the cell bodies here, and they will take the orders, right, to bringing them down, right, through these axons, right, and then they will come through this what we call corona radiata. You don't need to know that, right, and then they will go all the way here. At this point, as you notice, the medial part of the fibers here, those are the corticobulbar tract. What's corticobulbar tract? Those are the cranial nerves. Most of those are the cranial nerves. For example, like the facial nerve, right? So they will go and then they will separate from those, right? They will separate and they will go out. They will leave this tract and they will go out toward the motor nuclei of the cranial nerve, right? For example, the facial muscles, the muscles of facial expression, right? The rest of the fibers, other than the cranial nerves, which lives here, they will continue. They will continue down until they reach the level of medulla oblongata or medulla oblongata. The medulla oblongata is the level where many things happens, right? Particularly in this corticospinal pathways or motor pathways, what will happen? There is something called pyramids. Those pyramids are situated at this level of the medulla oblongata, and at this specific area, what will happen? Those nerve fibers or bundles, corticospinal pathways, bringing the motor from the right hemisphere, they're gonna cross to the left side, right? And those which are coming from the left cerebral hemisphere, left motor cortex, they will come, and at the level of the pyramid, at the medulla oblongata, it will cross to the other side, right? So now what will happen according to this? If you're having a problem or a stroke in your right cerebral hemisphere, what's going to be paralyzed? It's going to be the left side, right? If you're going to have a lesion or a stroke in the left side of cerebral hemisphere, what's going to be paralyzed? It's going to be your right side of the body, right? Why that's happening? Because of this decussation at the level of the medulla oblongata or the pyramids, right? So again, those motor nerve fibers at this level, this is going to separate and go towards the cranial nerves. It's going to be the corticopulbar tract, and then the rest of them is going to continue until the medulla oblongata, while here at the level of the pyramids, what will happen? I'm gonna have the decussation. The motor fibers are gonna decussate. They're gonna cross over from the left to the right, and those on the right they're gonna cross to the left, right? Now the question is, are they gonna cross like all of them, all the motor nerve fibers, the descending right ones? Are they gonna cross like 100%? No. The answer is no, right? 80 to 85% of them, they're gonna cross at the level of the pyramids, right, to the other side. Now, like 5 to 10% of them, it will continue at the same tract and going down this part here, right? Are they gonna continue like that? No. At certain level lower down, they are gonna decussate, they are gonna cross. Then at the end of the day, all the nerve fibers, corticospinal pathways, descending tracts originating from the right hemisphere, they're gonna decussate. 85% are gonna decussate at the level of medulla oblongata and the pyramids. 10 to 15%, they're gonna 15 to 20%, they're gonna decussate at the level, at lower levels, right? At lower levels from this side to the contralateral side. But the bottom line, all of them, they're gonna cross or decussate. Now, what will happen after decussating? Let's follow these. These guys here, they're gonna go in the lateral corticospinal tract. The guys which continue down, right, they're gonna continue in what we call anterior corticospinal tract. That's why the corticospinal pathways are two, right? Those which 80 to 85% which decussate, they will go in the lateral corticospinal tract, while the 20 to 15% which does not cross at the level of the medulla oblongata and pyramids, and they will cross down further down, they will go into this anterior corticospinal tract until they cross, right? So let's follow, for example, those lateral corticospinal tract. After crossing, they will come down, and then they will travel to the anterior horn, because as we mentioned earlier, the anterior horn is particular or specified for the motor, while the dorsal horn, as we have seen in the sensory or ascending tracts, is purely or mostly for the sensory and the ascending tracts. So ascending tracts, they will use the dorsal horns or posterior horns, and the ascending tracts or the the ascending tracts, they will use the dorsal or posterior horn, and the descending tracts, they will use the ventral or anterior horn, right? So going back to this, the lateral corticospinal tracts, they will go to the anterior horn or ventral horn, where they will synapse with the second order neuron. So see how long were those first order neurons. They started at the motor cortex. They will come all the way, they will decussate. Some of them will not decussate at this level, and they will come here and synapse with the second order neuron at the level of the ventral horns. And here, this is going to be the end of what? The end of upper motor neuron, because we name this part from the motor cortex all the way until until the end of the first order neuron. We called all those, we named it upper motor neuron part. And when the second order neuron, they will start from here, from the anterior horn, and they will go all the way until the muscle, whether it's an axial muscle or skeletal muscle, right? These from here and until the muscle, from the anterior horn and until the muscle, we have named that and called it what? The lower motor neuron, as we have done in this picture here, right? Very good. Now let's follow the 20 to 15% which continued in the anterior corticospinal tract. It will go all the way until here, the anterior or the ventral horn, where it's going to decussate. It's going to cross over to the left side. From those on the left, they're going to go to the right, they're going to go to the left, right? And then it will synapse with the second order neuron. This is the end of the of the upper motor neuron and the start of the lower motor neuron. Now, the question is, what muscles are supplied by this 85% of the fibers which decussated at the level of the medulla oblongata and pyramids? What does it supply? And this 15 to 20% which did not decussate here, what does it supply? The answer is the 85% which decussated, it will supply the lower part of the extremities, the muscles with the lower part of the extremities, upper limbs and lower limbs. Okay? Like when I'm moving here my hand, and even here my forearm and my elbow joint and my arm, okay, most of those muscles are by what? Are by the lateral corticospinal tract. What about the anterior corticospinal tract fibers? These one, like 10 to 15%, this one, the 15% to 20%, these ones are gonna supply the axial muscles of the trunk. For example, the muscles of my back, right? The muscles of my trunk, right? All these muscles will be moved by this anterior corticospinal tract. Does that make sense? Okay, everything we have mentioned, you are gonna see it in this picture. Okay. Finally, in this page, I would like to mention one information without going into too much details. Moving those muscles is not as easy as we mentioned. It's a very complex and sophisticated process. It's not only our primary cortex neuron there, which will do all the thing, this sophisticated and complicated process. This will be done through a very sophisticated system too. This system has important players. Those players, part of those players are the motor association cortex, basal ganglia, right, which controls something we call extrapyramidal tract, cerebellum, which has something to do with our balance, right, and it takes all the information, proprioception information coming at the subconscious level, right, and the hypothalamus and the midbrain, all those players, midbrain, hypothalamus, cerebellum, basal ganglia, motor association cortex, all those guys, in addition to our primary motor cortex, they will do an integrated job, right? Integrated job to accomplish this muscle movement in this very precise way. For example, if I decide just to grab something just next to me like that, this plan will go from my motor cortex, and just a copy of this plan will be distributed to all those players, to the basal ganglia, to cerebellum, hypothalamus, midbrain, motor association cortex. What do you think? This is a plan. He should go from here to there. This is the distance. He should use this muscle with this speed, with this contraction, like force and this and that, right? So everybody is gonna have his input. The basal ganglia will make adjustment and edit that plan. The cerebellum is going to edit that plan because the cerebellum is receiving the proprioception, and according to it, he's going to make the edits and the changes, right? And the hypothalamus and the midbrain. At the end, you are going to have the plan edited and adjusted by all those players together, and then you are going to have that very fine, precise movement that we do for everyday functions.